You see the price for a dental hygienist in Nottingham, £70 or more, and you wonder, is it really worth it? But what if that £80 appointment could prevent up to £4,000 in future dental and medical bills? This isn't about avoiding fillings. This is about preventing serious, body-wide health conditions. Because what a hygienist actually does is far more than just a clean. Let's break it down. We'll analyse the real costs, the hidden value, and the science to see if this is your best health investment. First, the price. In Nottingham, a private visit is typically £70 to £100. The NHS option is around £27. But there's a problem. Getting an NHS appointment is incredibly difficult due to wait lists and full practices, making private care the only practical choice. So for that private rate, what are you getting? It begins with understanding their distinct role from a dentist. Your hygienist is your first line of defence. They perform a full health assessment, screening for disease, decay, and oral cancer. They are also your personal oral health coach, giving specific advice to empower you to improve your daily home care routine. Let's look at the mechanics. Their main job is managing the area below your gum line, where plaque and tartar cause inflammation. If your gums bleed during a cleaning, many think the hygienist is being too rough. This is a common myth. The bleeding is a sign of pre-existing inflammation. They are removing the bacteria causing it, which is the first step to healing. Left untreated, that inflammation becomes gum disease, leading to bone and tooth loss. This visit actively stops that from happening. This principle of early detection is the key. Catching a small issue early prevents a costly, complex procedure later on. But the impact of that inflammation doesn't stop in your mouth. This is where the value proposition becomes truly surprising. Medical research shows a strong link between chronic gum disease and a higher risk of cardiovascular problems. The connection with diabetes works both ways. Treating gum disease can actually help improve blood sugar control. It even affects your lungs. Bacteria from your mouth can be inhaled, increasing the risk of respiratory infections. Beyond these major health threats, the benefits appear in your daily life, impacting your confidence and comfort. Regular cleanings remove surface stains, leading to a brighter smile. They also eliminate bacteria that cause bad breath. Neglecting this care can lead to chronic pain from cavities or advanced gum disease, affecting your sleep and concentration. There is another financial angle many miss. If you have crowns or implants, these visits are maintenance to protect that investment. So we've seen the health risks and daily benefits. But how does this connect back to that £80 versus £4,000 claim? Look at the cost of failure. A root canal and crown can be over £1,000. A dental implant to replace one tooth? £2,500 or more. And those are just the dental costs. The financial toll of managing chronic conditions linked to poor oral health is far higher. So now the numbers make sense. That £80 investment is an insurance policy against a £2,500 implant and costly systemic diseases. Remember when we said the hygienist is a screener and an educator? That is the mechanism for the savings. That inflammation we talked about is a systemic and financial risk. By managing it in your mouth, you reduce financial risk to your body. And in Nottingham, patient testimonials often mention feeling cared for, informed, and confident in their health. So, is a dental hygienist in Nottingham worth the price? The evidence is clear. Seeing it as a cost is the wrong frame. Your payment covers more than a simple polish. You are investing in early disease detection and protecting your quality of life. It is one of the few expenses that has a proven, dramatic return on investment for both your health and your finances. The question isn't whether you can afford to see a hygienist. It is whether you can afford not to. Look up local dental practices in Nottingham. Ask about their hygienist services and take a proactive step for your long-term health.